Welcome back to Understanding Depression, the channel where we mindfully explore the many layers of mental health to spread awareness, break the stigma, and build hope. Today, we're diving into a topic that's often misunderstood: bipolar disorder versus depression. They can look similar at first glance, but they are not the same. Before we start, don't forget to like, comment, subscribe, and share this video if you find it helpful. Let's grow a more compassionate and informed community together. Mental health is complex. Many people struggling with mood disorders often ask, do I have depression or could it be bipolar disorder? This is a crucial distinction because the diagnosis affects everything: treatment options, daily life, and long-term management. It's not uncommon for bipolar disorder to be misdiagnosed as major depression, especially if someone seeks help during a depressive episode. That's why this conversation matters. Understanding the key differences is a step toward early recognition and proper care. Let's explore this mindfully step by step. Stay with us, this could help you or someone you care about. Major depressive disorder (MDD) is more than just a bad mood. It's a serious mental health condition. The core symptoms include persistent sadness, loss of interest or pleasure in daily activities, changes in appetite or weight, fatigue, feelings of guilt or worthlessness, and sometimes thoughts of death or suicide. These symptoms must last at least 2 weeks and should be a change from previous functioning. Depression can vary in severity, from mild to moderate to severe. Even mild cases can greatly interfere with the person's ability to function. Importantly, depression is not a personal weakness. It's rooted in biological, psychological, and social factors. Some people have genetic vulnerabilities. Others develop it due to trauma, stress, or chronic illness. Understanding these layers is key to reducing self-blame. If this resonates with you, you're not alone. Stay with us. More insights are coming to help you better understand the differences. Bipolar disorder is different. It involves episodes of both depression and mania or hypomania. Mania includes periods of extremely elevated mood, high energy, reduced need for sleep, fast talking, racing thoughts, inflated self-esteem, and impulsive behavior. There are 2 main types. Bipolar I, characterized by full-blown manic episodes that last at least a week or require hospitalization. These are often followed by depressive episodes. Bipolar II involves depressive episodes and hypomanic episodes, a milder form of mania, but not full manic episodes. Bipolar disorder is not just about mood swings. These episodes are intense and can deeply disrupt daily life. During mania, a person might feel euphoric, overly confident, or even invincible. But these highs can be followed by crashing lows that mirror or exceed depressive symptoms in unipolar depression. Stick with us as we break this down further. Knowing the differences can be life-changing. One big reason people confuse bipolar disorder with depression is that both involve depressive episodes. In fact, many people with bipolar disorder seek help during these low points, and unless a clinician digs deeper into the person's history, the manic or hypomanic episodes may go unnoticed. That's a big issue. If bipolar disorder is treated with antidepressants alone, without mood stabilizers, it can actually trigger manic episodes or make the illness worse. That's why accurate diagnosis is so important. Another challenge is stigma. People don't always feel comfortable talking about manic behavior, especially if it involved mistakes, embarrassment, or consequences. But this silence only increases the risk of being misunderstood. If you've ever wondered whether your depression might be part of a larger pattern, keep listening. This could help you make sense of your experience. Let's talk about how energy and mood levels shift. This is one of the most telling differences between the 2 disorders. With depression, mood stays low and energy is usually depleted. With bipolar disorder, people alternate between periods of very high energy, mania or hypomania, and low energy, depression. These high periods may seem like bursts of creativity or confidence at first, but often they spiral into impulsive decisions, poor judgment, or risky behavior. Someone might start multiple ambitious projects, overspend, or suddenly travel without planning. Feels good until it doesn't. When the depressive phase returns, the contrast can feel overwhelming. This roller coaster of mood and behavior isn't typical in unipolar depression. Mindfully noticing energy shifts and their timing can be a key to better self-awareness. Stay tuned as we explore more. Thought patterns also differ between these two conditions. In depression, thoughts often center around hopelessness, failure, and guilt. A person may feel worthless, think they're a burden, or believe things will never get better. In bipolar disorder, thought patterns can shift depending on the phase. During a manic episode, someone may feel incredibly powerful or special. They might believe they're destined for greatness or have a mission others can't see. These ideas can become delusional in extreme cases. During mania, impulsivity rises. People may engage in risky behaviors, gambling, unsafe sex, reckless driving, believing they are immune to consequences. When the episode ends, regret often follows. Recognizing these shifts is vital for treatment and recovery. Still with us? Great. Let's keep exploring. In depression, symptoms might build up slowly, sometimes following life stressors like loss or trauma. In bipolar disorder, shifts can happen more abruptly. A person may feel fine one week, then suddenly enter a manic or depressive phase. Some experience rapid cycling with 4 or more mood episodes in a year. Because of these shifts, it can be harder for someone with bipolar disorder to maintain routines, jobs, or relationships. The unpredictability is part of what makes it so challenging. Learning to track mood changes over time can be incredibly helpful. Mood diaries or apps can help identify patterns and triggers. The more we know, the more empowered we become. Keep listening, we're almost there. Both conditions can deeply affect someone's life, but the consequences of bipolar disorder can be more dramatic because of manic behaviors, legal trouble, broken relationships, financial loss, and damaged reputations. Treatment differs too. Depression, usually treated with antidepressants, therapy like CBT, and lifestyle changes. Bipolar disorder needs mood stabilizers like lithium or anticonvulsants, and sometimes antipsychotic medications. Antidepressants may be used cautiously and only with mood stabilizers. Therapy helps in both conditions, especially approaches like CBT, psychoeducation, and mindfulness-based strategies. Thanks for sticking with us this far. In the next part, we'll humanize all of this with real-life examples. Let's meet 2 fictional people to bring this to life. Sarah struggles with depression. Every morning feels like climbing a mountain. She feels exhausted, disconnected, and filled with guilt. She pushes herself to get through work, but even fun things don't bring joy. James has bipolar disorder. A month ago, he was on top of the world, starting businesses, writing songs, barely sleeping. Today, he's unable to get out of bed, overwhelmed with regret and shame. Both are in pain, but the patterns, the energy levels, and the needs are different. Both need support, but different types. These stories reflect the complexity of mental health. If you've seen parts of yourself in them, don't worry. You're not alone. Keep listening. We'll wrap up soon with key takeaways. We know this was a lot of information, and we thank you for mindfully sticking with us. To summarize, depression involves sustained low mood and energy. Bipolar disorder involves mood swings from high to low. Accurate diagnosis is key to effective treatment. Remember, diagnosis is not about labels. It's about clarity, direction, and hope. Thanks for joining us in this mindful conversation on understanding depression. We hope this episode gave you clarity about the key differences between bipolar disorder and depression. If you found this helpful, please like, comment, subscribe, and share. You never know who might need this information today. Disclaimer: this video is for educational purposes only. It is not a substitute for professional diagnosis or treatment. Always consult with a qualified mental health expert for personal medical advice. Take care, stay mindful, and see you in the next episode.